So we all know that humans receive vaccines throughout their lives to combat newly discovered diseases and older diseases. But did you know that horses receive vaccinations every spring and also blood draws? The 5 vaccinations we give our horses are Eastern Western tetanus, West Nile virus that is transmitted through mosquitoes, rabies, equine influenza, and rhinopneumonitis. The blood draw is called a Coggins test, and that is used to look at the antibodies that are associated with equine infectious anemia, or EIA. And today I will be showing you how to do an intramuscular shot in the neck and how to draw blood from the jugular vein on the neck as well. And I'm going to start off by doing the intramuscular injection in the neck. There are also 2 other ways you can do an intramuscular injection, and that is in the chest muscle right here and in the butt muscle right here. But I'm just going to be doing the neck muscle because that's easier to see, and that is what I am more used to doing, because when I usually do intramuscular injections, I always do it in the neck. So when you are going to do the injection, you want to pinpoint where that muscle is, and by doing that it's called a triangle, and we just use our fingers to outline the triangle on the horse's neck, and then you go right in the middle because that's where that muscle is going to be. So once you pinpoint where you want to do the injection with the needle, you want to grab a flap of skin and move it around, and that's just going to relax the horse and kind of get its mind off of the needle, because usually they always know when you have a needle. And so once you grab that flap of skin, you want to hold the needle at a 45-degree angle to the horse's neck, and then you just insert the needle, and you want to pull back on the syringe a little bit, and you're going to feel like a suction, and that means you're in the muscle and you're all good. But if you pull back on the syringe and you see a little blood, that means you hit a vein, and you have to reposition that needle, because it is very important that whatever vaccine you have or whatever you're injecting is going to go in the muscle. So I can just show that. So you just grab your flap of skin, get that 45-degree angle, put it in, and then pull out on the syringe a little bit. And if nothing happens, just inject that in there. And then pull out, and then you want to massage the area to make sure nothing drips out and that they're all good. Next, I'm going to be showing how to draw blood from the jugular vein, which is right up here, and it runs down. You can see this indent in their neck. And the way you can do that is what you first want to do is put your hands around their neck, and you can see that there is a release here. According to biotracking.com, when you release, you can see the blood. There is a pocket that will fill and release every time you release, and that's where you know where to stick the needle. You can also, once you see that pocket filling up, you can flick it with your finger, and then you can feel it run down your vein and hit your thumb, and that's where you also know that you have the right spot. So, okay, so using what I just talked about, find and you see there's blood coming out, so that means I hit it and I got it, and you want to massage that area too to make sure blood does not come out. So what we have learned so far is how to do an intramuscular shot in the vein, in the neck, and the 2 other areas you can do that as well. Also, how to draw blood from the jugular vein, and the importance of doing shots on horses and giving vaccines and drawing blood. So hopefully now you know how to do shots and take blood from horses, I think it's very important for horse owners to do this because sometimes they can be very nervous and horses can sense that nervousness and they'll get nervous as well. And it can be a very nerve-wracking ordeal, and it'll be very hard from then on to do vaccines and take blood. But if you're very calm and collected, the horse will be as well. As you can see, she barely even flinched while I was doing all that. And it'll just make for an easier process. And then once you do that, you'll also feel better because then you'll know that your horses are happy and healthy.